Gauteng Health Department has confirmed a third cholera case. Now, the latest case follows two other cases of two siblings who developed symptoms on their way back from a funeral in Malawi last month. Now, the department says they have activated outbreak response teams and surveillance efforts have been increased. They're also working closely with the NICD, the World Health Organization and the National Department of Health, of course, to monitor the cases. Let's discuss this further with the Gauteng Health MEC, Nomantun Ralehoko. Thank you so much, MEC, for joining us this evening. How concerned should we be now with this third case that has happened? And of course, you know, is this now latest case also related to these other two cases?
Yes, I would like to confirm that indeed that the third case now that has been reported on the 7th, which was yesterday, is the latest that we have and is the husband of the first one that we confirmed, of the first lady that we confirmed. And you remember there were two ladies. So that first one is the wife to this gentleman that is having these symptoms now. And at the facility, he was immediately admitted, even himself, because of this incident. But even the two. But what we have been doing to prevent some of these issues is to do the tracing of other people that they've met with them or that they've traveled with them. So far, we have not get any results except this one that we've picked up then yesterday.
You know, let's just go back to the countries that they were traveling from, or the country that they were traveling from. Are we concerned that, you know, there might be a cholera outbreak in our neighboring countries, not just Malawi, if I'm not mistaken, is where they were traveling from, but are we concerned that there might be also an outbreak in other neighboring countries and that might also influence an outbreak here in South Africa?
It might be the case, but now we can pick up on the one that we are aware of, which is Malawi, because they attended a funeral at Malawi. Hence, there is that outbreak on our side, because all those cases are the people that were there. So we are concerned, but that's why we're not going to stop there. We are going to roll out the campaign even today. We were in Sebokeng at Boiketlo, because we're trying to conscientize communities now. Know that cholera is here. We have these cases that we have already picked up in the province. So there is this education that we are doing in all our communities. And we want us to be assisted by yourselves to ensure that we tell people about this. And we tell them about the do's and don'ts, and including the symptoms that if you see that you have diarrhea, just quickly go and consult the clinic that is nearer to you, especially if you have that watery diarrhea and you feel the symptoms of dehydration, because that's another thing that you will have. And we want you to go to the nearest clinic. But again, we want the public to practice proper hygiene, hygiene issues in terms of your hands. You wash your hands. You include thorough washing of the hands. We are even showing them how to wash your hands, how to wash your hands, to ensure that those things, when we have been using the bathroom, and all those basic things, including preparing or eating food, what is it that you must do? Don't just touch food by your hands without washing those hands. So I think we're going back to the basics of our healthcare issues, that we should be telling communities clean water, clean running water. Where there is no clean running water, we must know that there can be possibilities that we can have cholera. And those are the things that we must just get used to them as communities and as citizens.
Yeah, you've just spoken about the measures that one should take if you think you might possibly have cholera. I think a lot of people think it's just, you know, it can only be spread through contaminated water. But then, of course, you know, what's the likelihood that we could possibly see other cases?
I think because we are trying to prevent now, I don't think it will have a severe outbreak. That's my prayer and my prayer. I wish it can be listened by the men above, because if we get a severe outbreak, it will be very difficult for us to control it. Remember, we've got quite a number of informal settlements in the province. And that's why we want to focus to those specific areas that we know that we have congestion of a lot of people who have sometimes running water that is not right. And we want to appeal to the communities, let's not throw water in front of the areas where they stay, because sometimes that water just stays in the ditch and then it becomes something else at the end. So those are the basics that we should try and tell our communities not to do, the do's and don'ts, as I was indicated earlier on, because we want to prevent that. Because you remember we're coming from COVID-19 and we don't want to go back to that stage again. That's why already we've activated our teams in the department to go around the province to talk to social media about this. I'm sure you have seen even messages from the district offices of health, which is our regional offices in the whole province. I've activated all those teams because I believe that this must be stopped before it can get serious.
MEC, let's talk about measles, because as I read here now, the Gauteng province has to date reported a total of 47 confirmed cases, measles cases. There are 33 cases from Ekurhuleni district, 5 from Johannesburg district, 8 from Tshwane, 1 case from West Rand, and none from Sedibeng. But this number, 47, is it a number that we should be concerned about?
Yes, we should be concerned about that number because you can see that it's growing. And I think where we have not had the cases, I was saying even today, we must stop it because for us, indeed, this is a really moving target of the this cholera, not cholera now, it's measles now. But we're going to schools again. We have a campaign of injecting children between 6 months to 15 years, and those children are we're targeting the schools. But again, we're saying to them, the young ones, especially those that are not going to school, we're taking them to the clinics, and we have mobile units that are around the province, rotating in all the districts, telling the people about the importance of making sure that their children get the jabs, because measles, it's here, and once we have 47 cases, there are high chances that they can go higher. But we're preventing even that one, as I've indicated that this is what we're doing. This is the program campaign that we're doing in the communities now.
Would you say that the vaccination drive is going well, or would you like to see more people get vaccinated, apart from just, making people aware of the situation?
Yeah, the vaccination drive is going well, and I'm part of those programs. I have been in every area, as I've indicated, and I think we can get a higher number of people that will vaccinate. And I want to appeal to yourselves to assist us so that we make sure that this is being known again, especially on children, because we want them to receive the immunization, which we have, and we want the caregivers and the parents were urging them that their children, they must make sure that their routine of immunization is up to date. So that's the plea that we're asking the parents to do, because we want to protect these children and ensure that they don't get sick, because it's one of the serious diseases, even this one called measles. And other people don't take it serious because in most areas where I've been, we find that children didn't even have any of the injections that are related to immunization when they are young. But now we're helping them with this one. So those are the other cases that we want to prevent this too, so that it doesn't go further than this. And we're targeting that, hence we're targeting schools, we're targeting clinics, we're making sure that we have mobile units again, mobile clinics that are running around the communities. We have doctors on site in the communities, right, where they are. Yesterday we were in Bekesdal, and today we were in Gauteng, and on the other day, it was Monday, we were in Ekurhuleni. So we're taking rounds in all the province. On Friday, I know we'll be Johannesburg, but we're still sending a message to parents who are not signing the consent forms that they must help us and sign the consent forms, because even in schools where parents didn't sign consent forms, we're not doing anything to those children. We're not immunizing them because we need to get permission from the parents. So, and again, the emphasis to us, we're localizing health. We are not only focusing to you to go to clinic or to the school. We want to go directly to the houses. We do door-to-door, like we've been doing today. We've been doing door-to-door in the area, in the smoking hostel, because we wanted to take out people from their houses to go and do measles, immunization of measles and cholera, and the other things that we think, chronic diseases that are there, that we want to prevent them.
All right. Thank you so much. That's unfortunately all we have time for. Gauteng Health MEC Nomantu Nkomorale-Hoko for giving us an update there on not just the cholera outbreak, or the third case rather of the cholera cases that's been going up, and then of course 47 measles cases have been reported in South Africa. But as the MEC said, the vaccination drive is going speedily, it's going well, but more can definitely be done.